Hi, Terry Kuti with Deep Sea Foundation. We're continuing our discussion about seromas today, which is it's a fluid buildup after surgery. So, Dr. C, I have a question. Oh, by the way, Dr. Minas Chrysopoulo and Dr. Ramon Garza with PRMA in San Antonio. Forgot that introduction, gentlemen. So, Dr. C, a question. Let's say that a woman notices some fluid buildup after surgery.
Mm-hmm.
When should she start becoming concerned?
As soon as she notices it,
Okay.
that's when she should let her surgeon know. So seromas can happen anywhere someone has surgery.
Mm-hmm.
So if you're having
top or bottom.
So if you're having a breast reconstruction with an implant, you can get a seroma in the breast.
Okay.
If you're having breast reconstruction with tissue, then you can get a seroma in the breast, but also you can get a seroma where the tissue came from.
Okay.
So we typically use drainage tubes with our procedures after the first surgery. Some surgeons don't. There are other techniques that we can use in conjunction with drainage tubes or to try and avoid drainage tubes. But seromas they can be a very, very significant problem for some people, and very annoying and aggravating. So typically it's noticed after the drains are removed if someone had a drain placed at the time of surgery.
Okay.
The drain, so anytime you have surgery, if you think about, if you damage your skin, say with a burn or a bad graze, when you're healing it, it's kind of, the skin is oozing a little bit.
Yeah.
So I'm oversimplifying, but if you imagine that process on the inside of your surgery, the inside tissues, the internal tissues are acting the same way. So anything that's had the trauma of surgery produces fluid as part of the healing process.
Okay.
And if you've had drains, while the drains are in place, that fluid is sucked out. Then the drains are removed, and usually we use very set criteria to remove the drain. But sometimes we get caught out, and with extra movement after the drain has been removed, the body produces more fluid, and then instead of reabsorbing it, you get a collection of fluid, this fluid sac.
Can't get rid of it quick enough.
Right, basically. So then we can remove it by placing a syringe through the skin and sucking out that fluid, and then putting more compression over the area to help things stick. Sometimes it reaccumulates. There are substances that we can inject into the space to help it stick down, or sclerose, that's the medical term. And usually those extra little procedures work. Sometimes the drain has to go back in for a short period. Sometimes it can become even more prolonged than that. Thankfully, this is a rare event, but sometimes there's a cavity on the inside that develops that then has to be dealt with at the next procedure or through an addition.
Phase.
Yeah.
Okay.
So it can definitely be a very annoying problem. Thankfully, it's not too common that it gets to that point, but those are kinds of the steps that we take.
So can a seroma occur right after surgery, at a 2 or 3 week period after surgery? What's the time frame for something that could potentially develop like that?
Well, we see it, if it's going to develop, we see it later because we still choose to use drains, especially for the abdomen, for our deep flap procedures. But wherever we take tissue from, we're very much in favor of using drains. Some surgeons have moved away from it, especially for the abdomen, but we see a fair amount of high-risk patients, and we don't think that, generally speaking, it's a good idea for most people to go without a drain, but it is possible. So it's very much surgeon preference. So for us, we tend to see it when the drain comes out later on, because we don't have a drain anymore to suck the fluid out.
Right,
so,
makes sense.
Yeah.
Completely. Okay. Dr. Garza, what does the fluid, let's say there's a little bit of seepage. What does the fluid look like? Is there something that patients should be aware of?
Yeah, that's a great question. It's something we get asked frequently in the office. The fluid itself has a yellow tinge to it.
Okay.
So often the patient concern is this pus? Is this a sign of an infection? And the answer is no. That's the normal color of plasma. That's essentially what seroma fluid is like. It's very similar to the plasma that's in our blood. In that fluid are proteins, white blood cells, things that are normally found in your bloodstream, minus the red blood cells, which would make it that red color.
Okay.
So it does have a yellow tinge to it. So your gauze may stain that yellow color. Sometimes crusting can form around the drainage areas, or sometimes little look like particles within the drainage tube itself, and that's often just proteins that are precipitating out in the drain and can have the appearance of a solid object in there. But patients' main concern is this an infection? And the answer is no, it usually isn't. Signs of infection would include redness, spreading redness around the area, around the skin, pus coming out of the wound, which is a very milky color consistency. It is not a clearish type fluid, which a seroma is more clear. It's transparent, you can see through it. The pus pocket, or the pus itself, would be very milky in color and opaque. You can't see through it.
I would think a fever too would indicate.
Absolutely, yes. Fevers, just general feeling ill, the redness, worsening tenderness or pain. Those are all concerning signs. Thankfully, they don't happen very often after the surgery, but those are things to watch out for.
Okay.
And if someone notices the area getting larger, let's say they have a drain and all of a sudden it's getting, they're feeling fluid, it could be that the drain has stopped working. So that's another reason to contact the surgeon. And that can happen for a variety of reasons.
Sure.
Positioning, or maybe sometimes it gets kind of pulled out a little bit. So that's usually an easy fix, but that's something else to bear in mind.
Okay. All right. Very good. All about seromas. Thank you so much.